Hey, what's going on? It's Dr. Ganatra, and in this session, I'm going to show you exactly how to turn your office into any type of practice. So, you want to do more veneers? How do you turn into a veneer practice? Or an implant practice? What about a restorative practice? Or an all-on-4 practice? Maybe you're like, gosh, Ranesh, I love doing sleep dentistry. I want to turn into a sleep practice. Or I like doing, Botox or pain relief. I want to turn into one of those practices. How do you turn into any type of office? Any type of office. There is a strategy around this. There's a way you got to think through how you do things when it comes to marketing, when it comes to how you deliver that message and what you talk about with your patients. And I'm going to give you a framework for this entire thing here, which you can apply to anything you do in your office. So let's just jump right into it. Let's go behind the screen here for a sec. I'm going to move this up. And one thing to note is when you start doing this, you got to remember one thing. As you begin on this journey, you're like, I want to turn into, let's just take, for example, an implant practice. We'll use that for today's example. Here's what you got to keep in mind. That is, you must focus on one focus, okay? Not multiple focus points. One thing, focus on one treatment. So what do I mean by this? You're like, gosh, Ranesh, I do so many other things in my office. But when it comes to the message, how you relay that to your patients, how you relay that to your local community, pick one treatment and stay there. Whatever that treatment is for you. Remember, I said, hey, the promise of this video is to show you exactly how to turn into that type of practice. Maybe it's veneers for you. So we're going to take, in our case, we're going to take implants, right? We're going to take implants. Now, you can apply this to anything. Implants are just, we're going to take implants. You can apply this to anything. But let's just say you're taking implants for an example here. How would you turn into the implant practice in your area? So, one focus, you determine that focus and you stay steadfast to that focus and you really design everything you do in your office around that. Now, you can still do the other stuff, but all of those appointments that are the most valuable appointments, hey, your implant appointments. So how do you get it there? Well, you got to think through it like this. You got to have what we call many angles, all right? Many angles. So here's what I mean by many angles. You got 1, 2, 3, let's just put 5 angles in there. What do I mean by angles? And this is the marketing kind of perspective. So let's say one angle is you're talking just about single implants, okay? Single implants. Then the other angle is you're talking about mini implants. I'll explain all this, mini implants. And the other thing could be you're, talking just solely about overdentures. And then you can say, hey, we're also going to just talk about smile reconstruction and all-on-4s. So let's just do smile reconstruction here. Smile reconstruction. And then you can do all-on-4. Okay? Or, whatever you do in your office, right? I'm using that in a generic sense. So basically, these are the angles. And you may be thinking, gosh, Ranesh, what do you mean by angles? These are the angles that you're going to use to describe the treatment that you do in your office. And then you're going to use these angles, and essentially what's going to happen is you're going to use them to drive patients back into your office based on every angle. So your marketing is going to be about mini implants here. Like, oh, I'm going to market mini implants. And I'm going to next market single implants, and the messages in my marketing are going to drive my patients back to this one focus. Ooh, now I'm going to market all-on-4. Now I'm going to market smile reconstruction. I'm going to drive my patients back into my office based on these unique messaging points. So I'll give you an example. All-on-4, the messaging may be, hey, are you tired of wearing your complete full dentures? Are they getting loose? Can you not eat what you want to eat? Do you have a tough time eating the foods you'd love to eat? Do you have a tough time digesting your foods? Do you get indigestion? There's so many pain points around this. So what you do is you start talking about those pain points, and that's the messaging for this. And you drive those people with that messaging back into your practice. Then the next thing you do, you start talking about single implants, right? Or mini implants. Have you been told that you don't have enough bone in your mouth for an implant? Then you start taking that messaging and you direct it back into your office. Have you been told that, hey, you need dentures, but you're afraid of them being loose? Or do you have some ill-fitting dentures right now and you know that you'd love to get something that's more stable? And you don't want to spend a ton, but maybe you're talking about overdentures, right? So these different angles have different treatment messages, right? So different messages for every different angle. Those messages are now going to drive people back into your practice for this one focus, which is essentially implants, right? You want to place more implants. All of these angles require you to place more implants. But the key distinction here is you're using the different message wording, pain points, and transformations to drive people into this one focus. Now, if you notice, I just said transformations. The next thing is this. You must, and many people miss this because they don't do this part. You must have what we call case transformations documented. Have you documented all your case transformations? Meaning you can see that the patient started here, they ended up here. You had the before pictures, you had the during pictures during the treatment, and then you had the after pictures. Before, during, after. Every case, all of these situations here, you should be taking a before, during, and after for all of these situations. So that would be my next thing, which is case transformations right here. So you got to make sure you got the case transformations down. And those have to be in hopefully video format or pictures. Case transformation. So now basically what you're doing is you're showing different transformations for each of these treatment modalities, different transformations for mini implants, single implants, all on 4, and you're showing, hey, you know what? Here's a patient that came in and they had loose upper and lower dentures. They were sick of them. Here's what we did. Here's how we did it, and here's how it can help you, right? So you're showing that case transformation. You're constantly talking about that. That's the message that's baked into this here. And that case transformation is in video format, or it could be in still pictures, and it could just be like 5 or 10 pictures, and you narrating through those pictures, showing the transformation for that case. Now you have all on 4, and it's driving people back in that want all on 4, and that means they want more implants. You're going to get more implants in your office. Same thing here, single implants. The messaging around someone that needs a single implant is totally different than someone that needs all on 4. So the angle here is totally different. So you're going to use the angle for single implants with case transformation. So you're going to show videos, you're going to show pictures, you're going to show before the treatment was done, you're going to talk about during the treatment, do you have the video? And you're going to talk about after. And if you don't have video, you got to have pictures. If you don't have pictures, at least use stock photography or basic photography and start narrating and educating your local environment around the benefits of an implant and start solving the pain points of not getting the implant done. Gosh, if you're not going to get this implant done, we found that when you leave an open space open, that you start losing bone in that area. Bone loss can contribute to, a lack of facial structure as well. Bone loss can contribute to loss of bone around the adjacent teeth as well. You start hitting the pain points here, and those pain points are now baked into the message for single implants in your practice. Now, patients that come in for single implants, you know that, hey, they've received those messages. That's going to lead you back into doing more implants here, right? So once again, you're showing case transformations, right? You're showing case transformations either through pictures, video, or you narrating some stock photography. At least. Some of you are like, hey, Ranesh, I don't have any pictures of my cases. Well, this is a good heads up to say, hey, start getting some before, during, and after pictures of all your cases that you want more of in your practice, right? Now, the same thing can go for overdentures. Totally different messaging for overdentures, right? Totally different than for, single implants, than for smile reconstruction, right? You could be like, hey, they could be kind of the same. They could be kind of the same. Maybe smile reconstruction is more a mix of restorative and implants, right? So the message here has to then be different based on their pain points. And then you use those pain points to talk about them coming back into the practice. And now you're driving them in to get more implants done. So you can see here, there's three parts of this. There is what we call the different angles. I'll write that down here. Different angles, multiple angles, and angles. These are the different angles that you have to dive into as far as, hey, for implants, these are the different angles. Here it is for implants. Well, for implants, we got all this stuff going on, Ranesh. Well, you know what? We have the minis, we got this, we got that. That's all stuff going on for implants. These are my angles. Well, what could it be for veneers? What could be for veneers? Maybe you have totally different angles for veneers, right? So start talking about what are the different angles for veneers. God, maybe there's 2 central veneers. Maybe this full mouth veneers. Maybe there's 8 veneers. Maybe there's 6. Maybe there's 10 or 12, right? Maybe there's lower veneers. You have different angles for those things. Maybe there's a difference between a veneer and a crown. You can talk about that, right? So the different angles around the treatment tap into the different messaging in the patient's mind, and that unique messaging connects with those right patients, which then drives them back into your office for that single treatment that you're doing. You have to pick one treatment. And then what you're doing is you're using the case transformations to showcase what you can do. So this combination of case transformations, multiple angles around one focus, that's how you turn into the practice that you want to turn into. If you want to turn into an implant practice, this was our example today, and you don't have any case transformations around there, that's your number one priority. Start getting those case transformations. And if you're like, Ranesh, I can't get them tomorrow because I just haven't taken them, then get some stock photography, start narrating the different angles here, the pain points around them, that messaging around there, start narrating those things so then you can use that messaging to drive patients into your office and raise awareness around your area based on solving their pain points around those specific angles. All right? If you are like, okay, I want to do more of those implants, now I have those case transformations, you already have them, then you're easy. Like you can start using those for those multiple angles. If you don't, stock photography. If you don't have video, use pictures and really dial down the angles. For you, you're like, maybe you don't want to do all on 4. You're like, I don't want to do that. Well, then you have 4 angles. So figure out what that one treatment is. Then figure out the different angles around that one treatment. Then look at case transformation video or pictures or stock photography. Start narrating that through the pain points that the patient's having and drive them back into your office based on those pain points, based on those different areas of messaging. And you'll see you'll start attracting more of these types of cases into your practice. I hope this one helped. Let me know what you thought in the comments. As always, I love making these for you. Have an incredible rest of your day and live inspired.